All right. I am here with Amy Aubry. I'm so excited for this conversation. I've known Amy for, well, I don't know. It doesn't,
Almost 20 years.
it has, yeah, yeah,
Almost, yeah.
it feel possible. Um, and we'll get into that story a little bit more. I'm going to introduce Amy, but I'm really excited for today because you guys are going to learn about NAET, Nembutal's allergy elimination technique. And this is a modality that I've personally had really good results with as a patient of NAET. And so we're going to talk about how it can help with the allocation of resources in the body. So especially in my world with fertility, when we're looking at how does the body assimilate and allocate the resources so that your body can feel safe to conceive. And we'll talk about how the actual process of NAET works, how you can not only support people who are dealing with like literal seasonal allergies or food allergies, but hormonal situations, which, as I was describing to Amy before we hit record, I am like in the middle of at this very moment. So I'm probably due for a little refresher of some of these treatments, and how the process of NAT can actually check for what a body is sensitive to. So really excited for this. I'm so going to bring this, and we'll have a little a surprise announcement at the end of this as well that I'm super excited to share. So welcome, Amy. I'm going to do a little introduction because I'm very proud to know you and all the good work that you do. Amy is a licensed acupuncturist and holistic health practitioner with, yes, nearly 20 years of experience in integrative medicine. With advanced training in acupuncture, oriental medicine, pharmacognosy, medical ethnobotany, and NAET, she specializes in helping clients address underlying imbalances that may contribute to chronic symptoms, sensitivities, and blocked healing. By blending Eastern medicine, energetic therapies, and mind body approaches, Amey supports nervous system regulation, immune balance, and whole system well being. Amy, thank you for joining me today.
Absolutely. Thank you for having me.
Yeah, so I'm just going to start by letting people know that I've been in the middle of a hot flash for a few minutes, and I'm going to dab myself with some ice. So
Yeah. No
nice little
worries.
glow happening. And I have alluded to some of the perimenopausal changes that I've been dealing with on the podcast before. So it won't hit our longtime listeners as a surprise. It's not fun. And so we'd just been chatting about like, oh, NAET for hormones. I did some of those during my second
Mhm.
pregnancy
Okay.
when I was doing treatments with you. And that was night and day experience from my first pregnancy. And I'm
Yeah,
happy to share that story too. But yeah, it's like, whew, the any tools that we can get on board for these transitions of life, these thresholds.
for sure. Yeah. And those are often the most important time to be using the tools, implementing them, sometimes trying something new. But yeah, for sure, there's definitely ways of just helping ease the transition.
Yeah. I'll share a little bit more about how I came to be a patient of NAET, and then I would love to hear more about how you became a practitioner of NAET as well.
Yeah.
So I initially heard about NAET from a provider. This would have been over about 12 years ago because it was before my wedding. We had gone to visit an outdoor venue that we absolutely loved. And I had like this absolutely berserk allergy attack, like sneezing, eyes watering, snot everywhere. I mean, and you know, my eyes got all red and like swollen shut. And I was like, I love this place, but if this is how I'm going to react, I don't think I can actually get married here, or maybe just I shouldn't be trying to get married outside anywhere in Southern Arizona because
Mhm.
this would be not an attractive experience or fun. And so someone was like, oh, well, you should look into NAET. And I didn't know what that was, but this person is someone I trusted, and she was like, "I had amazing results with it." And there was a chiropractor not very far from where I lived at the time who was a provider for NAET, and so I did a series of treatments with her, and not very many treatments looking back. I think it was maybe only 6 treatments over the course of 6 months,
Mhm.
and I went back to the venue, like, after we put a deposit down. That was kinda like my moment of faith of like, "Okay, I'm gonna try it out." And I didn't have a response, and thankfully, I didn't have a response during the wedding. We were able to, you know, successfully pull that off without a sneeze. And, later on in life, after I'd had my first son, and I experienced some pretty significant perinatal depression, um, and postnatal anxiety, like postpartum anxiety. And as I was starting to think about preparing for baby number 2, my husband was legitimately worried. It's like, that was, the first time was really rough. Like, how can we make sure that you don't have that experience again? Like, what do we need to prepare differently? And I think, I don't know, were we out to lunch? Somehow my mom made the connection that you were,
Mhm.
practicing NAET, and I started that maybe a year before I got pregnant with my second one and just had a much different experience.
Mhm.
And so thank you,
Oh, yeah,
number
absolutely.
1.
Of course.
And it was so different from my initial experience with NAET because I think that practitioner, she was, like, on her way out to, like, retirement. She'd been in practice so
Mhm.
much time, and it seemed like she kind of had adopted her own ways of doing things that I wasn't sure how it was different, but it was definitely, a much more limited experience with just the very specific pollens. And
Mhm.
I remember we did, like, the basic 15, which I wanna
Mhm.
make sure we talk about because people are probably still, like, wondering what the hell NAET is.
Sure.
And then we did emotional clearings and hormone clearings, and there was just so many more layers to it that I found so supportive. I found that phase of life to be really expansive,
Mhm.
um, and again, like, so much different than the first one,
Yeah.
first
Okay.
pregnancy.
Yeah, good.
Yeah. So, I would love to know how you got into NAT, and then I wanna talk to people about what they could expect, or, like, what would even be the reason that someone would pursue NAET, if you
Mhm.
don't mind, but
Yeah, absolutely. So for me, I first heard of it when I was in acupuncture school. One of and your mom and I were in school together. So one of our classmates had gone through the NAET treatment, and his story just absolutely blew me away because essentially what he started with was what Western medicine looks at as a incurable ailment, and NAET made it into something that not only was manageable but something that he stopped having symptoms of. And so the short version of that story was, this was a classmate who he had been training to be a Navy SEAL. And in the beginning of that, they apparently provide vaccinations. And for some reason, when he went to get his, they weren't recorded. So they decided to give him the vaccinations again. And so his immune system essentially just got overloaded and he ended up with ulcerative colitis. So couldn't continue in the program. And every Western doctor that he saw, whether in the Navy or out of the Navy, basically told him, all we can do is really try to manage your symptoms. There's nothing much we can do. So was looking into alternative options and started seeing an acupuncturist actually in Phoenix, and she had trained in NAET. And she said, based on the what he was presenting with, she felt that NAET was going to provide him more relief than just acupuncture by itself. So he started doing the treatments, and he was pretty aggressive with it. It was just his personality type, so he went probably 3 to 4 times a week. But he said within something like 4 to 6 months, all of the issues he'd been dealing with were basically not happening anymore. So his story really got me intrigued and also super curious. When I started in acupuncture, I was fascinated with it, but like most people who grew up in the Western world, it was also a little bit woo woo, and it was kind of like, what is this really all about? And so, the same thing when I heard about NAET, it was like, well, how could something like that be so effective? And he was somebody that you wouldn't expect to really be into like an energy medicine. So the fact that he just went all in and he had such good results really kind of helped me to be like, okay, there's something really interesting about this. And then, so it was in the back of my mind that maybe someday I would train in NAET. And really the thing that I think inspired me or motivated me to do it the most was, I graduated, I started my acupuncture practice, and for the most part, people who get acupuncture get pretty good results. Just like any modality, some people respond better than others. But sometimes there were people who it didn't line up, the results that they, let's say, weren't getting, right? They were coming in as often as they were supposed to. They were doing the nutrition things, they were doing the emotional things, and for whatever reason, they just either weren't seeing any results, or they were just reaching this plateau where they would be better, but there was no moving beyond it. And so I just sort of, I started out frustrated, but then also thought, okay, well, maybe there's something else they need. Maybe there's something else that I don't know. Maybe another modality would also be helpful. And so that's when, that the call to learn NAET had always been sort of chomping at my heels, and I finally went and did the training in 2015.
Um, and having also known that classmate, I can attest to uh, how robustly healthy he is now, and
Yeah.
how, all of us, I mean, my mom, who was a pharmacist, me, who was like very science background, physiology major, research
Mhm.
lab nerd, to come to these types of what others may view as woo woo modalities, it often is because we had to go through something pretty rough to get there. We had
Mhm.
to go through the Western medical system saying, we don't really have any other tools for you,
Yeah.
or, just take this antidepressant, which, was in my case, how I just was like, well, no, like I don't have anything against them. And also like that just intuitively does not feel like what I need.
Right.
And what else can we look at here? So finding something that is safe and gentle and effective and has long lasting results and can help on a deeper level is that's where my brain wants to go now, even if it's not something that, we have the FDA level drug studies on double blind placebo controlled studies. Like that, it's really challenging to do that when everyone has their own unique biological makeup.
Yeah. And that was one of the first places where I really started to understand that each person is experiencing illness and disease and symptoms for different reasons. And so the Western model, which is putting a diagnosis onto somebody, you know, Unfortunately, I think even though that diagnosis is informative and can be helpful, it lumps everybody into this, group of, okay, I have this, and so these are my treatment options. And how NAET looks at it is there are many possible reasons why you have this. And so it's not necessarily just about treating the this, it's about balancing those reasons for why your body is now, you know, manifesting with this illness or disease. And so that's really been fascinating and eye-opening for me because, again, that was that was not something that I would have looked at prior to studying that modality.
Mhm. And so I wanted to look at how NAET can specifically support fertility and people who are having symptoms that seem to have some hormonal correlation, things like PMS, perimenopause, even some of the experiences of like the mood swings that I had in my first pregnancy, right?
Hmm.
That, people, oh, it's such a hormonal time. Um, I have a lot to say about that, but also it did feel very clear to me that there may be some level of sensitivity to the hormone changes. So,
Hmm.
how does NAET check for that? How does it address it?
Yeah. So it is really fascinating because you would think that something like hormones, which are a naturally occurring part of our body, we would just sort of be in balance with. But NAET has found that hormones are really treated and can act like almost any other allergen. So for whatever reason, some people, women and men, when they have hormone fluctuations and things change in their body, it is natural and it just ebbs and flows and it's fine. And other people, their system sees it as a reason to defend in some way, shape, or form. So NAET looks at allergies a little bit different than Western medicine because, yes, it does include those things that are causing an actual immune response. And they'll look at the different antibodies for different things, and that is part of it. But it's more than that because it's really looking at anything that's causing the body to defend, right? And so that defense can be an immune defense, it could be a nervous system defense. We see the reactions of that through our emotions, um, right? Through sort of the fight or flight reaction. So anything that's not letting the body kind of go to or stay in sort of that rest and restore mode if and when it needs to. And that really could be just about anything, depending on how our system or how our mind is interpreting it. Um, with hormones specifically, it can be an actual immune response, but more often than not, it's just those like really extreme responses. So, mood swings are normal, but extreme mood swings would be indicative of a possible sensitivity. Just like the acne and digestive things and other PMS symptoms that women have. To a lesser degree, those would be normal, but to a greater degree, that's typically indicative of some sort of either energetic blockage or sensitivity. So it's not too far off from how Chinese medicine looks at it, and NAET is based on some of the principles of Chinese medicine. So the two do, mirror each other a bit in theory. Um, and it's one of the foundational treatments that we would do for someone starting out NAET. So balancing the hormones, obviously hormones are essential for, not only reproductive health, but our whole system. So that is something that we look at pretty early on, regardless of why somebody's coming in for treatment.
Yeah. And for fertility purposes, um, it's funny because as I was going through that and I look back at that period of time when, after I'd done the basic 15, I kind of found my rhythms of life. And I look back at that as like wow, like I was in a really good place. And, when things are really good, you don't always think too hard about it. And then in retrospect, when you're looking back at like, what was different then? What
Hmm.
was going on then? And why do I think it was also so much easier, not only to conceive, but pregnancy and postpartum? And I do believe that that had an impact, but it was really subtle
Hmm.
too. And it like accumulates over time,
Yeah.
which is, one of those little sort of sneaky things that I think those of us like who are used to like Amazon delivery that we're like, I want results yesterday. But
Hmm.
what can people expect when they're starting NAET treatment? What can they expect as far as a timeline of healing?
Yeah, yeah. And that's, again, kind of goes back to it's not necessarily the most fun answer to hear or to even give, but it's different for everybody. Um, I'll just kind of touch on the basic 15 to give that foundational starting point. And again, everybody's different. So this would be sort of the systematic approach. But the way that Dr. Nambujarpad, who started this modality, the way that she teaches it, and her son, who's since taken over, is to check and treat everyone for what we call the basic 15. So these are very essential things: vitamins, minerals, nutrients, and then hormones, which no matter what a person is doing in their life, no matter what kind of diet they follow, right, whether they're vegetarian or doing keto or avoiding specific foods, these essentials we're all getting because we have to. We need them, right? They're sort of the foundational building blocks. And so, what Dr. Nambujarpad found early on when she was sort of figuring out this modality was that she could start to treat someone for like a whole food, let's say milk. And just treating for milk would typically yield results. And it's kind of like the experience you had, right? You came in with a specific thing going on, and that provider treated that specific thing. And so there's nothing wrong with doing it that way. But what Dr. Nambujarpad found through the years was that those treatments, sort of one off or just for a specific thing, don't typically last as long. And often, um, they're sometimes it's like peeling the layers of an onion. So there's usually more going on than a person being allergic to one thing. And so, because of that, Dr. Nambujarpad created these basic treatments, which check and treat people again for all these foundational things. So it's not to say that everybody needs all of the 15 basics, but what I've found through the years is that I want to say 80 to 90% of people do need probably 80 to 90% of them. So that's going to be a bit of a time commitment because you're going to have to get probably 10 to 13 treatments. And then once those are done, it becomes a much more individualized experience. So those are really setting the foundation. They help to boost the immune system because they give it less to do. So again, because, even if you're avoiding trigger foods or things in the environment that trigger your immune system, you're still getting exposed to those basic elements, right? And so anytime you take those in, even if it's a very low level reaction, your immune system is still active, which requires energy from your body. So once those basics are done, your immune system stops reacting to them, which then means your system has more energy to put into other, parts of the body. It also means that now, instead of your body maybe fighting against iron or fighting against something else that you need, it's assimilating those things. So we're getting more nutrition, we have more energy because less energy is being used to defend. And so it is subtle. We feel better, but it's hard to necessarily pinpoint exactly why. So then, after the basics, then it becomes very specific. So if somebody has a cat allergy, or if somebody is focusing on fertility, or right, it's really going to be what are you looking to get out of this, and we focus the treatments on those. um it is kind of interesting though, because we use muscle testing as one of our main ways of determining what a person is sensitive to. And so every so often a person will come in with a specific idea of, okay, I'm allergic to cats, let's do this. And then the muscle testing will indicate, okay, yup, there's an allergy to cats, but it's not the priority treatment. There's other things that the body actually needs to balance and clear first. Other people, the body might just say, yup, treat the cats. So you do have to be a little bit open to, it may not be a linear experience of healing. And everybody's experience is going to be slightly different.
Yes, I definitely recall that as part of things like, "Oh, we come and think we're clearing calcium," and then it's like, "Oh, no, it's actually anger today." How
Yeah.
interesting.
Yeah. And I can share a little bit about my personal experience with it, which, a lot of people enter into NAET either because they experienced it themselves or they had somebody close to them go through it. For me, it was the friend's story. And I went into it thinking, well, this is really interesting and fascinating. There's not really a whole lot I'm allergic to. So I don't really know if this is going to be a modality that will benefit me. Um, but I did have just kind of what I think people in Western culture consider sort of annoying everyday symptoms, just things that happen that you're just used to dealing with. Headaches once or twice a week. I was allergic to jewelry. That one I knew. I broke out in a rash one year from a watch band, and I couldn't wear earrings. So I thought, okay, I can treat those. But there was no foods that I knew I was obviously allergic to, right? I didn't eat something and then go, oh, wow, yeah, that's bad. Um, but what I found through doing NAET was there were a lot of very subtle, low level sensitivities. Um, the most obvious shift that I had physically, I've had a lot of shifts emotionally, but physically, um, after a few years of being married, I started to get a rash from wearing my wedding band. It didn't bother me in the beginning. I would get a little rash when I'd wear earrings and necklaces, but the ring had never bothered me. And then after a few years, it started to bother me. So, I had gone through the basics and was at the point where it was like, okay, well, I can just treat things when I need to treat them. And so, the muscle testing showed I was allergic to diamond and to nickel. And so I had those treatments done and they cleared. And I started wearing my ring again and it was fine for a little while. And then the rash came back. And muscle testing indicated I was not allergic to anything in my ring. And so that was really perplexing and frustrating. And I had been doing some self treatments. And at that point, I thought, well, I'm going to go see a practitioner because I don't know what to do. um, and so we also will do blood work with NAET if somebody wants to check for food sensitivities. So I had done that mostly out of curiosity. And I was actually surprised to find that the blood work revealed I did have some food sensitivities, nothing major, but I did have some. And again, when I'd eat those foods, I couldn't have noticed a difference if you would have asked me. But the provider that I was seeing suggested, well, why don't we treat you for the foods that are coming up in your blood work? Because maybe the way that your body's reacting is with a rash on your finger. It's sort of like it's the place where your system is kind of weakest. It's the weak link. And so again, that did not feel logical to me. It was not like a one-to-one connection, but I thought, okay, why not? I'll get these treatments. It will help my immune system not be and reacting to things. Um, and it'll be sort of an interesting experiment. And so it was probably 8 to 10 things. And so I started going and getting those treatments. And nothing changed. Rash on my finger. I was frustrated after each treatment. I probably should have had frustration in there at some point as a treatment. Um, but I didn't start focusing on emotions until later. Um, the last one on the list, I did the treatment with her. And within a couple days, the rash was gone and it never came back.
Yeah. It's so fascinating.
So it's just, I think for me, it was a really good lesson in, again, I think our Western brains, we do want that one to one explanation and we want it to be like, oh, yeah, that makes perfect sense. But when we're adding in the element of the energetic system, unfortunately, we can't see this system. So there's a lot going on that's outside of our physical senses, right? It doesn't mean it's not happening. It just means our physical senses can't perceive it. But there's interconnections and there's things going on. And once that gets unraveled, the body kind of goes back to its state of balance. So it was really fascinating.
Yeah. Oh, that's a good one, and I'm sure you've seen so many others have similarly nonsensical, illogical experiences, but it just is such a it speaks to how we have this physical body, and we're used to wanting to see, like, here is a lab test, and here is what we do with this, and here is the result we expect. And then, we have the energetic body and the emotional body and the spiritual body, and we have all of these unseen layers
Hmm.
that are also influencing the physical body.
For sure.
So, what have you observed as far as like that emotional, energetic, spiritual component with
Yeah.
NEET?
Yeah. I mean, it's been a huge shift for me. I think when I started out this journey, again, we're raised with sort of the Newtonian separate mindset of body, mind. If there's something going on mentally, we look to change things chemically in the brain. And if there's something going on physically, we're looking for a physical root. And now the way I look at it is all completely interconnected. I mentioned that frustration came up a lot in those early treatments. And Dr. Nambujirpad, actually, one of the books she wrote was all about, and this was later on in her process, was all about NAET for emotions, because she found that many of people's allergies and sensitivities and physical reactions were tied to emotions. And so they could be an actual sensitivity to the emotion itself, or the emotion gets linked to something physical. And this
Yes.
happens a lot with
Yes.
digestive stuff because the way that we eat in our culture is usually quite hurried. Maybe distracted while we're watching TV. Um, we're often not in the rest and digest mode. And so energetically, stuff gets intertwined,
Mhm.
and that causes all kinds of chaos later. So it is intrinsically linked as far as I'm concerned. But the good news is there are modalities that really can help reset the balance. I know that you have learned some through the years. NAET is definitely a powerful one at that. And it's like you said, the shifts, some people do have dramatic shifts with NAET, but usually it's just this slow, steady, often very subtle change. We never tell or ask people to change anything else they're doing when they start NAET. So don't come into it thinking, I'm gonna, stop taking my allergy medication, or, once I get one treatment, I'm gonna immediately change my diet, or I'm gonna do this or that. Um, because each treatment is building on the previous, and it is sort of a slow steady shift. But ultimately, what typically does happen after a few months, and maybe longer depending on the person, is people are able to either lessen or remove allergy medications, or they can change their antidepressants, and obviously they would work with their doctor to do that. But the system, as it's regaining balance, is able to pull from its own natural resources then.
Mhm. Yeah, and so when I think about fertility and just, like, kinda how the body almost has, like, a hierarchy of survival, so it's gonna send resources towards the vital organs first,
For sure.
and then anything that is not vital organs, so skin, hair, reproductive system is, like, kinda, second tier, and
Yep.
so symptoms that pop up in there are often, they're signs. They are vital signs of
Yeah.
some sort of imbalance occurring in the body,
Uh-huh.
but they're not pathologic. The blood work might look normal.
Right.
There's so much that you have to, ask differently, and sometimes asking the body through
Yeah.
other means, like the muscle testing. That's where, like, for me, the training that I have with, like, the subconscious
Uh-huh.
has be an alternate pathway to find those answers. So just knowing that we have ways, we have paths,
Uh-huh.
multiple modalities that can support these folks who have that experience of, like, I've tried everything
Uh-huh.
and nothing is working.
Yeah. And that's where something like NAET often becomes it to me it often feels like this missing link modality, where people have been doing the things that we say they're supposed to be doing. Maybe even they've tried energy work. And it can even people who, if it's emotional, they've done therapy, and then they just feel like they're not making the progress that maybe other people are making, or how they thought it would work. um I find that NAET is very useful in those cases. It's almost like there's, if you want to look at the flow of energy, and then having sort of something that's interfering, and NAET is in my experience what just helps remove some of those blockages to healing.
Mhm. Well, I love tools that are safe and effective and
Yeah.
provide gentle relief without having
Mhm.
to without having to overhaul your entire life, because I think that we're already, like, we're all stressed out enough.
Yeah, for sure. And it's,
So
as much as I have become kind of a cheerleader for the daily practices, and um empowering people to have sort of that active role in their health and well-being. um Sometimes life is just busy, right? You can only add so many things to your to-do list. And so being able to find a treatment that you just go, you get the treatment, it helps your system without you having to do one more thing. um it's great. I think it's a great tool to add to the toolkit for sure.
well, and I think there's definitely a difference between what are the active rituals and nourishing practices that you can have on board on a daily, weekly, monthly basis versus the I think so much of what maybe comes from like this cultural urgency and hustle and trying to do things perfectly and throw everything at the wall and see what sticks. And
Yeah.
like that's maybe the difference that I perceive there is like NAET is a way to slow down and listen to the body and
Hmm.
actually respond in kind to what the body is saying it needs,
Yes.
which is a different experience than just, well, let's just slap another med on it and see what
Yeah.
happens and come
Yeah.
back in 6 months.
Yeah. Well, and sometimes the things that come up are so, it just really helps you to understand the importance of being in tune with yourself and your needs, right? Not necessarily, the latest guidelines for everyone. Um and with some of the things that we find during the treatments that a body actually needs to be balanced for, we've said this earlier, it doesn't always make logical sense in terms of what society thinks, but for the people who are receiving it, and that muscle testing says, I'll say something like, muscle testing is telling me to treat for um like chickens, and that won't even be anything that came up for them. And then they'll usually sit there and think about it. And I had one experience where the client said, when I was like 6 years old, I was in my grandpa's barn and we were walking past a door and a chicken like jumped out and just scared, like it just scared me. And it's one of those imprinting moments that hangs on, right? No logical reason to be scared of chickens. And as a adult, not actually scared of chickens, but when she thinks about chickens, that's still there and it's
Mhm.
affecting her system in some way. And her body has said, hey, I don't need this anymore. Why don't you go ahead and balance that and clear it? So it is really fascinating, and just reminds me every time I do it that we are all unique and have our individual needs and stories, and we can work with them and not against them.
Mhm. Well, and that's beautiful, and I think it's also a beautiful segue into, what I'm really excited to share with everyone is that you're gonna be joining us here at Grace Natural Medicine in Oro
Yeah.
Valley to share your brilliance with NAET, and this has been such a full circle, knowing each other for so long, you having been classmates with my mom almost 20 years ago in acupuncture
Mhm.
school, and me having benefited so much from NAET, it just I couldn't have I didn't know this was gonna happen, and I'm so thrilled.
Me too. Yeah, the timing just worked out perfectly. So I'm super excited.
It did, especially because every time I would, over the last, gosh, 4 years, when I would think about someone who was like, "Oh, you really probably need NAET," and I wish you could go to the person I went to because they they were amazing. So I'm really thrilled to have someone in-house to refer to who I, know and trust and have experienced great results personally with, um, and to be able to offer that to people is just really lovely. So I'm excited and thank you for
Oh, I'm super excited to be a part of your clinic and to get to hang out with you guys. And yeah, absolutely. Dream come true.
and I love having all of these sort of meeting points of the different ways in which we all work with energy and just have it be very collaborative, and it
Mhm.
just feels really juicy. And
Yeah. Yeah. I think we're going to create our own little vortex there.
well, yes, it's so funny because even when like I've mentioned to people that before the drywall mud went up, when they just had the drywall up, and I had gotten keys to the unfinished space, and I would come in and write on the walls.
Nice.
And so every single wall in this building has something positive written on it. And then before we actually started seeing patients here, we had a local shaman come in and help set intentions for the space and speak to the land and um, actually work with like the energy in the rooms to say like, okay, here's where we would imagine like when someone is ready to let go of something, this is the drain that we
Oh,
can
beautiful.
release from. And this is a space where people can feel really safe to come in with whatever it is they've been grappling with and just be able to like take a deep breath and feel safe to heal and safe to let go. And
Nice.
so, yes, it is an intentionally little vortex created space.
Lovely.
um, Well, thank you so much for being with us, Amey. We are going to link your Facebook group in our show notes on the podcast, as well as the information page about you on our website and NAET and how to book with you for people who are local here in Southern Arizona,
Hmm.
and how to get in touch if they have more questions.
Yeah,
Um,
absolutely. I just love sharing this modality. Even if I'm not the person that someone comes and sees, if people have questions and just kind of want to get a better feel for it, I'm always happy to talk about it and to educate and share my experiences. So please reach out.
Yes, awesome. Of course, because there's people all over the country who listen to the podcast, and so they might not have ever heard of this and realize that it could help
Yeah.
them. So
Yeah,
they can also search for that or reach out to you to find out more about energy work with you.
definitely. Definitely. Yep.
Awesome. All right, listeners, thank you for being here. As always, if you found something useful from this episode, take a moment to subscribe to the podcast, rate it, share it with a friend who you think might benefit from this. Sending you so, so, so much love as always.